Good afternoon. We are here, Marion and I, to do our regular Tuesday briefing on a Thursday because we had been out earlier in the week. Today, I'm going to review the COVID-19 situation in PI and Canada and speak briefly about the new travel measures, our vaccine rollout, and self-isolation. There is one new case of COVID-19 to report in PI today. We currently have 12 active cases and 175 cases since the pandemic began. This individual traveled to PI from outside of Atlantic Canada and is self-isolating. Contact tracing has been completed. There is a public notification associated with this case. Anyone on Air Canada Flight 8302 from Montreal to Charlottetown on April the 17th should monitor themselves closely for symptoms of COVID-19, and if any symptoms develop, they should be tested and continue to self-isolate until they receive a negative result. Globally, there have been over 144 million cases of COVID, and the World Health Organization reporting a record 5.2 million new cases in the past week. Domestically, Canada has recorded over 1.14 million cases and over 23,700 deaths. There were 8,421 new cases reported in the last 24 hours and almost 90,000 active cases throughout the country. Over the past week, there's been a 21% increase in the number of new cases reported in Canada. COVID-19 continues to spread at record levels across the country. The third wave of COVID-19 is proving to be devastating in some jurisdictions, with health systems being overwhelmed. We have surpassed the daily case count of new cases and the number of active cases that we experienced at the peak of the second wave in early January. During the past week, Canada surpassed the United States in the average daily rate of new cases. In addition, the number of cases confirmed as variants of concern continues to rise rapidly, with over 70,000 cases reported in Canada. 96% of the variant cases are the B117 mutation, first identified in the United Kingdom. And B1167 is a new variant of interest, according to the BCC Centre for Disease Control, and it's first sequenced in India, which is causing concern. It is described as a double mutant strain that appears to be causing severe illness. In PEI, we've reported 10 cases of the B117 variant of concern. Similar to other jurisdictions, we now assume that all new cases are variants. The variants of concern are associated with increased transmission and virulence, and we are all still learning about the effectiveness of approved vaccines against a number of the variants of concern. The impact of the variants is clear, with hospitalizations up 34% across Canada and ICU admissions up 22% in the past week. There is a trend towards an increasing number of COVID-19 related hospitalizations in people under the age of 40 and a decreasing trend in the need for hospital care for cases over the age of 60. In Atlantic Canada, we've reported 274 new cases of COVID-19 in the previous 14 days. And as a point of reference, when the Atlantic bubble was closed on November 24th, we reported 218 cases of COVID-19 in the region in the previous 14 days. There are 261 active cases in Atlantic Canada today, and only 205 when the bubble closed in November. Nova Scotia has reported over 60 new cases in the past 2 days. And we have heard media reports of potential community transmission in that province. And we also will be following up with Nova Scotia following their press conference this afternoon. As I stated earlier this week, the numbers across Canada are going in the wrong direction. We've not yet seen the worst of this third wave of COVID-19. The increasing number of variants of concern, the sharp rise in the number of cases and more severe disease and health system capacity being outstripped by demand all suggest we should not relax our public health measures. In PEI, we are trying to achieve herd protection where at least 80% of the population have been immunized fully with the 2 doses of vaccine. We continue to make good progress with our vaccine rollout, and our focus is to immunize as many island residents as possible, as quickly and safely as possible. As of Tuesday, April 21st, 46,278 doses of vaccine were administered, including 9,768 second doses. 27.4% of adults over the age of 16 have received at least one dose of vaccine, and 7.3% of island residents have received 2 doses of vaccine. This week, individuals aged 50 to 54 can book appointments at the health PI immunization clinics across the province. And starting today, frontline workers aged 16 to 39 who work with the public and who cannot work virtually can book their appointments. Frontline workers include teachers, school staff, including bus drivers, early childhood educators, grocery store and retail staff, public transit drivers, and food manufacturing and processing workers, to name a few. Island residents over age 55 years of age and older can choose to have the AstraZeneca vaccine by making an appointment at one of the 12 partner pharmacies throughout the province. AstraZeneca is an effective vaccine, decreasing your chances of moderate to severe disease, and is used in 110 countries around the world. Some jurisdictions have started offering AstraZeneca to people younger than 55, and that is based on their epidemiology. We are expecting to receive new recommendations from the National Advisory Committee on Immunization later this week, and we will make decisions on the use of AstraZeneca after we receive these national recommendations. We received good news in the last week about our allocation of Pfizer vaccine. For May and June, our allocation will be double what was originally projected, meaning we will receive an additional 47,430 doses over this 2-month period. This increase in supply will result in the availability of more appointments, allowing some individuals to receive their first dose earlier and others to have second dose appointments sooner than the previously communicated 16-week timeline. Certain groups have been prioritized to receive their second dose of vaccine as close as possible to 1 month after their first dose, based on their risk or likelihood of experiencing severe outcomes from the disease. These groups include the following: residents of long-term care and community care facilities, rotational workers and truck drivers who travel outside of Atlantic Canada, seniors living in the community age 80 and above, individuals undergoing treatment for cancer, and all other individuals who received a first dose should be given a second dose as soon as all those age 16 and above have been offered their first dose. Given the supply forecast, we hope to be able to offer everyone a second dose no later than 12 weeks after their first dose. Pfizer has submitted clinical trial data to Health Canada for the safety and efficacy of their vaccine in children aged 12 to 15. Approval of the use of this vaccine in this age group is anticipated in the coming weeks. And if approved, the Pfizer vaccine could be administered to 12 to 15-year-olds later this spring, allowing us to expand the number of island residents eligible to receive the vaccine. Thank you to all island residents who are eager to be immunized and are showing up for your appointments with your sleeves rolled up. It's important that people receive their second dose. While 1 dose provides good immunity, the second dose is needed to boost and maintain protection against COVID-19. When it is your turn to be immunized, please book an appointment to get your first of the 2 doses of vaccine. There will be vaccine for everyone who wants to be immunized. Vaccine fact sheets and posters are available online in multiple languages for individuals, businesses, and service organizations. As I've mentioned previously, each person who is immunized benefits all of us. Island residents can continue to help in the COVID-19 response by following public health measures as they have done so diligently during the last 13 months. This includes staying home when sick, washing your hands often, getting tested if you have symptoms, keeping your circle of contacts small, and wearing a properly fitted mask in indoor public places. I ask Islanders to continue to do their part and get vaccinated as soon as it is your turn. PEI's had border measures in place since the early days of the pandemic. Pre-travel approval based on travel streams, and with border screening at all points of entry, and daily check-in calls and follow-up with people in self-isolation. These strict border measures have been the foundation of our provincial response to COVID-19. Recently, other provinces have inquired about our systems and our processes with the intention of learning from our experience, and many, I'm sure you've heard, are putting their own border measures in place. Based on the data and epidemiology of COVID-19 in Canada, we were challenged to consider how we could strengthen our existing measures earlier in the week. So as we announced on Monday, measures were implemented to pause some travel to PEI, especially from outside of Atlantic Canada, until at least May 17th. And I want to be clear, PEI residents should not leave the province unless it is absolutely necessary. People living outside of PEI should not travel here unless it is absolutely necessary. Some travel to PEI will continue to be permitted in accordance with the existing travel streams, specifically compassionate or work reasons. We are working with Health PEI to increase testing at points of entry, and we'll be focused on Borden, but also the airport and Wood Islands. As I said earlier this week, we need to buy time. We need to take the necessary steps to protect islanders until we have more people vaccinated. Our experience to date with this virus demonstrates just how vulnerable PEI is to the importation of COVID-19. Almost 70% of our cases have been linked to domestic or international travel. The legal requirement to self-isolate upon arriving in the province has been a key element in breaking the chain of transmission and limiting the spread of COVID-19 in our province. While most people want to do the right thing and follow the self-isolation rules, there are some individuals who do not want to self-isolate because they believe they do not have COVID-19, or they will not get COVID-19, or they've not been in an area where COVID-19 is present. And moreover, the virus presents no risk to themselves or others. And some people believe the self-isolation rules do not apply to them, and they choose to put themselves and others at risk. Some people do not acknowledge that as a province, we remain in a state of public health emergency and are in the midst of a global pandemic. To individuals who feel this way, I can assure you that when our office calls people to tell them their test results are positive, they are usually very surprised. About 1/3 of these individuals have no symptoms of COVID-19. When making these calls to newly diagnosed cases who are following the self-isolation rules, they and we feel a tremendous sense of relief knowing that they've had very few, if any, close contacts. No one wants to be responsible for spreading COVID-19 to their families and friends. Over 21,000 households have successfully completed self-isolation in the past 13 months here in PEI. Thank you to the many island residents and visitors who have respected the rules and the legal requirement to self-isolate. Together, you have helped all islanders. Going forward, our enforcement partners will continue to monitor and follow up on people in self-isolation. To date, they've responded to 766 complaints regarding self-isolation, issued 205 warnings, 140 charges, including 7 pending, and conducted almost 1,200 random checks of individuals in self-isolation. Pandemic fatigue is widespread. Like all islanders, I want the pandemic to be over and for life to get back to normal. Our team and partners feel the same way. While to date our focused efforts to reduce the health impacts of the pandemic and limit societal disruption have been successful, they have caused us all to be weary. The harsh reality is that in Canada, we have never been more vulnerable to COVID-19 than we are right now. This is not the time for us to let our guard down. I know I've heard the Premier say, this is the time to keep our stick on the ice. As a country, we think COVID-19 is going to get worse before it gets better. I do expect to see more cases of COVID-19 in PEI, and now is the time to stick to our game plan that has worked well to date. We will continue our efforts to limit importation and contain the spread of COVID-19. We know the basic public health measures work against the virus, including the variants of concern, and the vaccine is a sign of hope. We are in a race to get island residents fully immunized as this crushing third wave of COVID-19 is spreading across the country. I am so encouraged by the response of PEI residents to the opportunity to be vaccinated. Well, we look forward to spring and summer in PEI. We can be grateful that we are able to do most of our normal activities with some modifications. And we are hopeful that we will continue to enjoy this level of activity and that by the summer we may be able to welcome some of our off-island family and loved ones to spend time in our beautiful province this summer. But as I have to remind myself and you as well, we have to do this one day at a time right now. So as we continue to support one another, let us continue to be patient and kind. Thank you.
Thank you. Good afternoon, everyone. We continue to closely monitor the ongoing COVID-19 situation in PEI and across Canada, working closely with Dr. Morrison and her team. As has been mentioned, vaccination clinics continue to immunize large numbers of people from our eligible populations. Clinics have been going smoothly, and we're scheduled to immunize over 6,000 people this week. I want to remind Islanders that an appointment is required to receive your vaccination at community clinics for all individuals. If you do arrive with your spouse or partner or person you're caring for without an appointment, you'll not be able to receive the vaccine at that time. And this is because our vaccine available at the clinic each day is based on the number of booked appointments. For those of you who are waiting for your second dose appointments within the next couple of weeks, you will start receiving automated messages or phone calls from our booking system, Skip the Waiting Room. As Dr. Morrison mentioned, we received good news this week on an increased allocation of doses of the Pfizer vaccine. We're currently planning for how early we can begin offering those second dose appointments, and we'll be following the guidance that's provided by CPHO for getting people, those particular groups, their second dose as quickly as possible. Please follow the instructions on the automated message or email that you receive to confirm your second dose appointment. You will have an option to reschedule your appointment at that time as well if it's necessary. You do not need to call the 1-844 booking line to book a second dose appointment, and we ask that you don't go online to book your second dose appointment, as we'll automatically send you your second appointment. There is an option with the 1-844 line to cancel, reschedule, or change your vaccine appointment at the community clinics as well. And you can also cancel by clicking the link provided in the confirmation email you received from Skip the Waiting Room if you're provided that email at the time of your booking. This week, we continue to book appointments for individuals aged 50 to 54, and today vaccine bookings are also open to those frontline workers aged 16 and above, who interact with people in the public who can't work virtually, and Dr. Morrison mentioned a number of those groups. Next week, we'll begin booking all adults aged 40 to 49. This is a large age cohort, so it's broken down into 4 groupings according to birth month. So beginning Monday, April 26th, individuals born in the months of January through March. Beginning Tuesday, April 27th, individuals born in the months of April through June. And beginning Wednesday, April 28th, individuals born in the months of July through September. And on Thursday, April 29th, individuals born in the months of October through December are able to book. Appointments can be booked directly using our online booking system at princeedwardisland.ca/getthevaccine. And this is the quickest way to book your appointment. It is very busy. It's easy to use, but we want to remind people it is open 24 hours a day. And if many people are booking as soon as their group becomes available, it can cause some delays in your ability to access the appointment. You may have to try back in a few minutes. Trying throughout the day is what we would recommend for this large group coming next week. Those who aren't able to book online can call our 1-844-975-3303 line to speak to a booking clerk. I also want to remind individuals that if you're over the age of 55, you can call one of our 12 partner pharmacies to book an appointment for the AstraZeneca vaccine. And this is an excellent option as you may get the vaccine sooner than the supply allows us to provide other vaccines in our community clinics. I wanted to make a couple other comments this morning, just reminding people who need COVID test results if you are having to travel for essential reasons. There is guidance available on the website about the timing and to plan your test in order to receive your results before you travel. I also want to remind everyone about the safety of our hospitals and health system and that they are safe. They're prepared to care for people with COVID-19 as well as continuing their usual business. We have many processes in place to make sure that our patient care areas are safe, and much of our health system is vaccinated, including those staff in emergency departments, ICUs, long-term care, and in our COVID units. We follow strict infection control protocols, and appropriate personal protection equipment is being used. If you have an appointment, please attend it. Your doctor or nurse practitioner has made your appointment because it is important to your health. So I ask that you do please attend your other appointments within our health system. Thank you to everyone who continues to follow the public health measures and the guidance from the Chief Public Health Office. And we'll continue to get the vaccines out as soon as they arrive. Thank you.
Thank you, Marion. And we'll open it up to questions from the media.
Wayne Thibodeau, CBC.
Good afternoon, Dr. Morrison. Maybe we could just start. I know there are lots of concerns around travel right now. Can you tell me what exactly is happening at the airport right now in terms of checkpoints, and what we'll also see set up on May 1st should the ferry open on schedule?
Hi, Wayne. I mean, I think you're right. There are a lot of questions about travel. At the airport for quite a long time now, anyone arriving at the airport is screened, and they need to have, if you're not a resident of PEI, you need to have a pre-travel approval letter. There's a special code on the letter that they have, and that means that a self-isolation plan has already been reviewed and looked at. But they are asked questions, and information is gathered from every returning traveler. Everyone arriving in from outside Atlantic Canada is required to self-isolate. We have testing regimens in place for those arriving from outside of Atlantic Canada. There are, of course, for rotational workers and truck drivers, well, not truck drivers, but rotational workers arriving at the airport, then they are also would need to have testing done in that 0 to 1 day. So the testing is not being done at the airport at this point in time, but they know they isolate until they get their next test or their first test the next day, and they have to remain in isolation until that negative test result comes back. If someone does not have the requirements or meet the requirements to come into Prince Edward Island, we did some of this explanation in the summer as well, that they would be then turned around and put on the next available flight. Right now, the next available flight is often not till the next day, so they would be escorted to a hotel facility for an isolation overnight, and then put on a plane back to their point of origin. And Wood Islands. So discussions are ongoing with Wood Islands. One of the considerations in terms of adding additional testing there, we had obviously the similar kind of screening for everyone last year, but to also do some screening and testing actually while on the ferry itself. And so that is being looked at right now.
Great. And if I can also ask you a bit about booking, we are now seeing people booking well into June for their vaccinations. So I know you did mention that we're going to get up to 47,000 more doses in May and June. So I guess my first part of my question is, will that open up more appointments, and are we going to meet that target of having everyone's first dose by June? And if someone has an appointment for late May and we get these additional doses, does that mean their appointments will be moved up, or will we simply add more people to the list?
Maybe I'll start, and then I'll get Marion can also add to that. So Absolutely. The extra Pfizer that we will be getting in is really good news, and it does mean we will be able to meet that target of making sure that everyone before the end of June, likely by the middle of June, will have access to at least one dose of vaccine. And so, I mean, I guess that's the first thing. And we are certainly having conversations with Marion and Health PI about how we can get their people's first dose even earlier, and even one of the things that they're working on, I know, and Marion, you can add to that, is the ability for people to be able to rebook their own appointments earlier, so that if they're, they were in Skip the Waiting Room, they'll be able to do some of that rebooking themselves, and I think that will be really important going forward. And I think it's also important to note that there are appointments still available in May in different parts of the province, and I think people. There are definitely appointments available even as of this morning in multiple locations across the province earlier than June. But we will be quickly adding more slots for people, and I think that's really good news. Marion, do you want to add to that?
Yeah, just a comment that it's, of course, some of the Pfizer doses will replace what we had expected to receive from Moderna, so those clinics may have already had appointments associated with them. Now that supply has changed a little bit for us, so that will take some. So we're just currently mapping out how much additional that will have, and also linking it with the groups that Dr. Morrison mentioned today, who were aiming to have their second dose appointments closer to that 1 month mark from their first dose. So, and some of those individuals, we may not know that they're undergoing cancer treatment currently and that type of thing. We know who the long-term care residents and staff are. We also can identify those individuals over the age of 80. So we'll be looking at sending those second dose appointments out as soon as we can, in doing the math and the calculations for which doses are already allocated to appointments, for which supply, and the timing of that supply coming in. And I'm glad Dr. Morrison mentioned as well, there are still hundreds of appointments available in May, throughout the middle of May toward the last couple of weeks in May, in various locations across the province. We know the Charlottetown location has had lots of demand, and there will be additional appointments added there. And the other piece is that people can, I mentioned briefly in my notes today, when people have received their confirmation notification from Skip the Waiting Room for their appointment, it does give them an option to reschedule their appointment, and they can call or go online and book a new earlier appointment if appointments get added to our system, and then cancel their other appointment through the notification, whichever means they have asked to receive that. We also have put an option on the phone line for our booking system if people are looking to change their appointment and they're not comfortable using the online system, where they can select that option to connect to our booking staff about rescheduling their appointment. So it's been one of these challenges of trying to meet the demand and also adjust for the particular groups as they're being phased out. And it's one of the reasons why people haven't necessarily received their second dose appointments yet. And they will be coming out to folks within the next week or so, especially those individuals who received their first dose toward the end of March. But we will be doing them as soon as we can based on our supply.
I think it's just worth
Thank you both very much.
Wayne, it's just worth reminding people as well. We only get a certain amount of vaccine into the province every week, so that's why we can't add more appointments than we have actual vaccine.
Thank you very much.
You're welcome.
Louise Martin, CBC.
Hello, and good afternoon to both of you. I'm going to start with the rules around truck drivers. Some have reached out saying they'd like to see a 24-hour, 7-day-a-week testing clinic in Borden because they're arriving at all hours. Wondering if there's any consideration being given to that, and also if you can just go over what exactly the isolation rules for truck drivers who are awaiting results are.
Hi, Louise. So that's one of the, the things I sort of alluded to, but Health PI, we're working with Health PI and have been working with them for the last number of days to increase the hours at Borden testing site because we recognize that when we have put in place that truck drivers and other rotational workers need to self-isolate until they have their first negative test result back. That means that when they're only going to be here for a short period of time, and many of them are only in the province for a limited period of time, that they do want the results back really quickly, and we totally understand that. So we're working to see what we can do to make it the tests not only more available, but also in consideration of how we use some of our ID Now tests that may be able to provide even faster turnaround. But if it's not ID Now, we just in general to have that turnaround as fast as possible. I actually looked at the turnaround times for our lab tests across the board yesterday, and I think we would be the envy of every other province in terms of the turnaround time of our lab tests. So I think that's important to mention. I think we recognize the challenges with our truck drivers especially, but we also know that because of the work they're doing in and out of Atlantic Canada, when there's so much COVID in many other parts of the country, they are at risk themselves, and also I know they don't want to spread COVID to their families or to the community. So it's how we try to go forward with that. But we are trying to look at more testing, more time, and quicker turnaround for that group in particular.
Thank you very much. The quick ID, I think you mentioned, that's the rapid testing, I'm assuming?
Yes, it's one of the tests we've used in terms of some of the surge capacity, but that is a discussion ongoing with Health PI because it's with all of these everything that we do, we need to have people to do them. And so we're just trying to make sure that we have the right resources in place.
I know you expressed concern, as many people did, when we heard the numbers out of Nova Scotia today with 38 new cases, and then the reports, as you also mentioned, of community spread. How worried are you that could happen here, given we know that some people are not following self-isolation regulations here?
Well, Louise, I think we've been talking about our concern for some time. It's also why we've kept our border measures in place. We monitor the people coming into the province in a different way than Nova Scotia. We always have, and so I think it reinforces. For now, we need to continue doing what we're doing in terms of isolating those who are coming in from all the other provinces. But we know there's tremendous disease pressure in the country, and it makes us concerned. It's why we've put these only certain travel streams in place. We've talked about our testing. We have a very good testing regimen. We have enforcement partners. We have our Health PI testing partners. So I'm always worried that we could see an outbreak here, but I feel like we need to do everything we possibly can every day, and that is not just those involved, but all islanders to do their parts so that we can continue to have kids go to school, so that we can continue to go eat at restaurants, that we continue to do a lot of the things that we're enjoying here, and that we also don't want people to get sick. And as soon as we start seeing more cases, then they may result in more illness that really impacts the system.
Thank you so much
You're
for your
welcome.
time today.
Welcome, Louise.
Allison Jenkins, The Guardian.
Yes, good afternoon. I guess I'm wondering how many people are getting vaccinated every day? Just wondering about numbers.
Okay. Do you want to answer that?
Sure. Yeah, it's on average around 1,000. As I said, there's over 6,000 people this week, but it does depend on our supply each week and what comes in. So on average each day, another 1,000 people are immunized right now with our current supply, and that will increase, of course, in May as the supply increases.
It will likely get up to closer to 10,000 people, 10,000 people a week in May.
Okay. And so just wondering if there will be any, if you'll be like reporting on the daily vaccination numbers. Other provinces are kind of releasing those numbers every day. Just wondering if PEI plans to do that and why or why not.
So hi, Allison. So one of the things that happens, we have a sort of COVID-19 vaccine registry, and those are loaded into the registry, and then they're basically validated to make sure that there aren't errors in that upload into the registry. And we have decided that we are giving that information twice a week. We report it on Tuesday, and it's updated on the website based up until the previous Saturday night. And then we report it again on Thursday, and that is from basically Saturday night through until Wednesday night. And so that is what we had agreed to at the beginning. And we have data people, health PI, our epidemiologist who's working on this vaccine record. So that is what we've been doing. Certainly we may be open to change that, but we want to be very comfortable and know that the numbers that we are putting out twice a week are really accurate, and they reflect exactly who's been vaccinated. We also upload, of course, the information from pharmacy, so that is also included as part of the COVID-19 registry.
Okay, and those are reported online or in the briefing?
Both. So the numbers I used today will be on, if they're not already on the website, will be there momentarily.
Okay, thank you. That was 3 questions, so thank you very much.
You're welcome.
Julien Lecachère, Radio-Canada.
Good afternoon to you both. Question en français pour vous, Dr. Morrison. Ça va reprendre un petit peu ce que Wayne Thibodeau vous a demandé en anglais plus tôt concernant la vaccination et les dates de rendez-vous. Si on essaie de prendre un rendez-vous actuellement à l'île du Prince-Édouard, on parle de au moins 30 à 40 jours pour obtenir un rendez-vous. Il n'y a quasiment plus rien au mois de mai. Parlez-nous de ces délais et pensez-vous que ces délais vont se raccourcir dans un avenir proche?
Bonjour. À ce moment, à l'île du Prince-Édouard, on a beaucoup de possibilités d'avoir un vaccin les 2 dernières semaines de mai. Ici, à Charlottetown, c'est un peu plus tard. Mais maintenant qu'on sache qu'on va avoir un grand nombre de plus de Pfizer vaccins qui arrivent la première semaine de mai, on va ajouter des cliniques. On espère avoir plus d'accessibilité pour avoir les vaccins pour le mois de mai. Et on s'organise entre Health PI et nous autres comment exactement ça va aller. Et puis, si on ajoute plus d'espace ou on ajoute des heures aux cliniques. Et puis, il faut organiser un peu parce qu'on veut avoir les deuxièmes doses pour plusieurs groupes. Mais maintenant qu'on a plus de vaccins entre le mois de mai et juin, tout le monde va avoir la chance d'avoir leur première dose de vaccin. Je sais que Marion, moi et même le Premier ministre, on attend, on n'a pas encore eu la chance d'être vacciné, mais on espère avoir cette chance dans le mois de mai.
Vous avez dit, Dr. Morrison, qu'au mois de mai, vous espériez vacciner ou donner 10 000 doses par semaine aux insulaires. Et du coup, est-ce que donc vous êtes toujours en chemin pour votre objectif de la fin juin des 80%? Et aussi, est-ce que vous allez raccourcir les délais pour la deuxième dose? Aujourd'hui, on est à peu près 16 semaines. Est-ce qu'on va passer à 12, 8?
Et, je m'excuse parce que j'ai mentionné aussi en anglais que, oui, avant la fin de juin, j'espère qu'on va avoir tout le monde, 80% des insulaires 16 ans et plus qui vont avoir la chance d'avoir au moins leur première dose de vaccin. Et puis, ça a l'air comme on peut même réduire un peu le temps entre la première dose de vaccin et la deuxième dose à 12 semaines au lieu de 16 semaines. Alors, je sais c'est beaucoup de travail pour les personnes qui font les vaccins, mais ça va augmenter assez tellement vite ici pendant les 2 mois qui suivent.
Merci beaucoup.
Rachel Collier, the Eastern Graphic.
Hi there. I guess, with some tightened restrictions as well as people getting a little tired of restrictions and rules, I'm wondering if it might be interesting to know at this point how many hospitalizations here on PEI would cause sort of hospital bed shortages or other disruptions in health PEI services. I guess this would be for Marion.
Yeah, hi, Rachel. Well, I think our capacity is quite small for managing to continue on with a surge in cases while continuing to be able to offer our regular health services on the island. So we've, as Dr. Morrison mentions, we're quite fortunate here to have been able to continue on with things like in-class learning and recreational activities and restaurants. We've also been able to almost fully operate our health system with regular services across the system. So we have plans in place to have that surge, and it's been quite some time since I've been talking about it here because we've not seen the cases coming into hospital, thankfully, up until this past week. So really we have capacity to increase our ability to care for ICU patients and COVID positive patients, but with that increased surge in those patient demands means we will have to reduce other things that are also happening and other care that's provided, elective or otherwise, in our other health care settings. So it is a balanced approach. We have capacity to manage some. I don't have an exact number of how many would put us into that, but certainly the limitations on our staffing abilities within some of our facilities are also a limiting factor as we continue to move forward. And we've been able to continue to offer, as I said, the majority of our health services to everyone as we've rolled through these past 2 waves. So we need to keep a close eye on, and we're very much in support of the public health measures and the border measures that have been put in place that has protected our system and enabled us to offer those other things.
Thanks for that. Yeah. And I guess just another question that came up. I know previously the old Riverview Manor, or I guess it might be referred to as Rosedale Center now, previously that was, I think, going to be used as an overflow for folks in long-term care if that need was there. I guess now, with so many vaccinated, is that even needed, or is there another facility that is set up for overflow?
Well, we still have the Rosedale Care Center as part of our plan if it was necessary, but our situation has changed greatly in our long-term care and community care facilities since that was first established. So first of all, we now have our residents of those homes vaccinated, fully vaccinated with 2 doses, and have plans and ability to vaccinate those other islanders or residents who may be waiting to move into those facilities. Also, a good compliance of staff working in those facilities being vaccinated. So that's changed a little bit about having the need for Rosedale, but we do maintain that resource and that facility to be able to be activated if it was necessary for some capacity or overflow within our system. Currently, we're using the Rosedale Care Center as our immunization location for our Montague Clinic. So that's what we're using that resource for now, but it does remain a resource that we could deploy if we needed to create capacity within our system.
Okay, thanks for that.
You're welcome.
So thank you very much, Marion. Thank you all, and we appreciate your time. Enjoy as we almost go into another weekend. Enjoy another weekend in PEI.